Attachment in children and adolescents. Throughout this presentation, we will look at the different aspects of attachment, the different theories of attachment, and how it changes through the stages of life. What is attachment? Attachment is the emotional bond between two people. In fact, skin to skin contact is crucial after a baby is born in order to create the foundation for attachment between mommy and baby. How does attachment work biologically? There are three important connections the brain produces in order to formulate a bond. The first one is neuroanatomy of the brain, the second is neurotransmitters, and finally hormones. Role of hormones. Just like the brain uses neuroanatomy to make connections, hormones are similar. There are two neuropeptide hormones that the body releases to make that bond. The first one is oxytocin and the second is vasopressin. For example, during birth and lactation, oxytocin is released, therefore skin-to-skin contact plays an important role. Oxytocin levels in parents. A recent study shows the higher the level of oxytocin in a mother, the more affectionate and nurturing she will be towards the baby as well as a stronger bond. Fathers also showed stimulation of oxytocin during the 6-week mark and 6-month mark after the baby was born. Attachment as a theory. There are three theorists who focused on the attachment theory. Each of them had a different perspective. We will look at the perspectives of the following: Freud, Harlow, and Erikson. Freud. Freud noted that most infants are attached to a person or object that provides oral satisfaction. For example, a pacifier provides oral satisfaction. When you attempt to take away a pacifier, the infant or child becomes upset because it gives them oral satisfaction. Freud thought infants were more attached to mothers because they provided that oral satisfaction. Harlow disagreed with Freud by the results of a study he conducted. He did a study on monkeys. One group of monkeys was fed by a cloth surrogate mother. The second group was fed by a wire surrogate mother. In conclusion, the monkeys that had the cloth mother spent more time with her due to the fact that the other monkeys were scared of the wire mother. Harlow concluded that feeding had nothing to do with attachment. In addition, he stated that contact and comfort is a crucial element. Erikson believed comfort plays a role in attachment. First year of life establishes the stage of trust versus mistrust. Physical comfort and sensitive care is what establishes trust in infants. Trust is then turned into the foundation of attachment. What is trust versus mistrust? Child is completely dependent on other people for satisfaction. If the child's needs are satisfied on a daily basis, the child will feel secure and comfortable. If their needs are not satisfied, the child will develop mistrust. They will develop insecurities, fearfulness, and mistrusting. They will also struggle with relationships in the future. 4 phases of attachment. Bowley believed a bond is not natural, but rather developed over time. He also claimed that a child is naturally born with attachment instincts, thus why they cry and cling to a person. Bowley created the 4 phases of attachment a person will go through in their lifespan. Phase 1. The phase is from birth to 2 months. During this phase, they will have direct attachment to any human figure. For example, parents, siblings, and grandparents. Phase 2. From 2 months to 7 months. Attachment is focused on one figure, which is usually the main person who cares for the child. At this age, the child is able to distinguish familiar people from unfamiliar people. Phase 3. From 7 months to 24 months. Specific attachments form. The child will seek daily contact with caregiver, such as mother and father. Phase 4. From 24 months and on, children will soon be aware of others' feelings, goals, and plans. Recent research to Bowley's view of attachment. Although Bowley's findings on attachment are correct, recent research shows some characteristics are developing sooner. For example, in Phase 4, children who start to understand goals and intentions of their caregiver are now starting to develop them in Phase 3. Also, there are links of attachment to emotional understanding and self-perception. Strange situation. Mary Ainsworth created the strange situation. This is a way to measure the attachment of a child by observation. She introduced 3 unsecure attachments and 1 secure attachment. 1. Securely attached babies. They are comfortable and calm when introduced to a new environment. They will explore the room in the presence of the caregiver. If the caregiver leaves, they are aware, but they might protest, but they are not alarmed. When the caregiver returns, they resume back to normal. 2. Insecure avoidant babies. They are insecure and they will avoid the caregiver. They engage in little to no interaction with the caregiver. They are not alarmed when the caregiver leaves the room. If the caregiver tries to have contact with them, they will turn their back or look away. 3. Insecure resistant babies. They cling to the caregiver, but they will also push and kick her away at the same time. Their children are anxious, and when the caregiver leaves, they cry loudly and will push her away if she tries to comfort them. 4. Insecure disorganized babies. These children are disorganized and disoriented. In unfamiliar situations, they appear confused and fearful. They must show strong signs of specific behavior such as extreme fearfulness around the caregiver in order to be classified as disorganized babies. How attachment affects functioning. Attachment securely between 24 and 36 months is connected to the child's enhanced social problem solving at 54 months. At 2 years, attachment securely can lead to lower levels of peer conflict at 3 years old. Cultural differences in attachment. Studies have shown that cultures do impact the way a child attaches to their parents. For example, German infants are more likely to fall under the category of insecure avoidant babies. In German cultures, caregivers encourage their children to be independent, thus concluding that culture and environment play a huge role in the development of an attachment. Attachment in adolescence. We all know that raising teenage kids is hard. Their attachment to their parents significantly lowers. Parents anger when teenagers start slipping from their grasp and they can no longer have total control. This results in arguments, name-calling, and threats. Teens' desire to spend time with their family lowers, and they want to spend more time with friends. Children who have had insecure attachment with mothers showed higher levels of anxiety than those who had a secure attachment as a child. Securely attached adolescents were less likely to engage in problem behaviors such as juvenile delinquency and drug abuse. In a longitudinal study, kids who were securely attached at age of 14 had positive outcomes at the age of 21. This included success with relationship, competence, and financial careers and fewer problematic behaviors. Securely attached children are emotionally stable, they have a higher level of self-esteem, and positive attachment to peers, especially in a relationship with the opposite sex. Insecurely attached adolescents were found to be less attached to mom or dad, also had more attempts to commit suicide, and higher levels of anxiety, difficulties with relationships with peers. How to create a secure attachment. With all this information given, the real question is, how do I create a safe, secure attachment with my child? As an infant, the caregiver should be sensitive, caring, and nurturing with the baby. They should provide constant, stable care, and they should engage in playful interactions. Caregivers are a secure base for babies to explore their environment. Secure attachment is vital in the first year of life because it provides a firm foundation for later psychological development. Depending on caregivers, commitment on early attachment that would influence a child's social behavior later in life. Caregiving styles. Available to respond to the infant's needs, they let their babies actively have part in how much interaction they choose to have in their first year. United States and Colombia, maternal sensitivity was linked to secure attachment in infants. Even though maternal sensitivity is connected to the development of secure attachment in infancy, it is good to remember that connection-wise is not especially strong. How insecure attachments are developed. Caregivers do not engage in any involvement with the child. They do not meet the baby's needs. They show no affection or physical contact towards the child. Their caregiving is inconsistent and unstable. Other ways insecure attachments can develop. Postpartum depression occurs when the mother develops depression after birth. It occurs from hormonal change, tuning into motherhood, and fatigue. This can be very serious for the foundation of attachment between mommy and baby. Effects of postpartum depression. Difficulty time bonding with the baby. Mothers may be neglectful due to the depression. In severe cases, they may even harm the baby. Babies may develop poor cognitive and behavioral development. Attachments can change in different stages of life. Although your child may have a secure attachment, they can change to any of the other forms of attachment. It happens with sudden, unexpected change, such as school, daycare, change in childcare, or even going back to work after maternity leave. Examples of attachment change. My 2-year-old niece had a secure attachment with my sister. We left on vacation for 5 days and we left her with my mom, whom she has a secure attachment as well. She had never spent more than 1 day away from her. We came back from vacation and now she has separation anxiety and insecure attachments. Summary. Now that you are informed of the different types of attachment, you can see what type of attachment you want to form with your child. We learned there are 4 types of attachments. 1 is secure attachments and 3 insecure attachments, which include insecure avoidant babies, insecure resistant babies, and insecure disorganized babies. We learned how crucial it is for the baby to have a strong bond with their caregiver. We learned of different ways we can become good caregivers. Different ways we can give our babies our full attention and fulfill their needs. We also learned how culture may have an impact on what kind of attachment the child develops. When it comes down to attachment and the parent's role in this concept, it is to be attentive but not overprotective, to let them grow a sense of autonomy, but also be a security blanket when